Earlier this year, the BBC channel covered the story of Diane Covey, a 69-year-old retired hospital worker who's been referred by her GP to the Royal Surrey Hospital in NHS for a chest X-ray because she's been suffering from a cough. Just like hundreds of other patients who visit the hospital that day, her care team has cleared her X-ray as normal and sent her home. It just so happened that this is the day that Harrison.AI technology is going live. And within hours of being switched on, the case has been analyzed by the AI system and flagged something subtle, something that was originally missed by the radiologist. Stage 1 lung cancer. What would have been a death sentence was caught early enough to change everything. When interviewed by the BBC on how she felt about her scan being analyzed by AI, Diane said, of course in a very beautiful British accent, "I never really understand AI, but I think it might have just saved my life." Thank you. The fact that my cancer has been picked up early gives me options. I feel that I have a second chance at life. Next slide, please. Diane is not the only one. If 100 people get diagnosed with lung cancer today at stage 1, with all of our modern medicine, in 5 years, only 5 of them would survive. But if we could just rewind the clock, wind back time, and diagnose them earlier by 12 to 18 months at stage 1, 65 of these people would still be alive 5 years later. The math is simple. Early and accurate diagnosis just save life. The question is, why don't we all have this? Why can't this happen all the time? Well, we're in the middle of a massive capacity shortage today in medical expertise. Before turning startup founder, I was a doctor. It took me 6 years to be trained at University of New South Wales, and probably another 9 years if I want to become a specialist. In Australia, we are shorting 1,000 radiologists, and that number is just much bigger in the US and China and overseas. Even if we start today by hiring and recruiting and training all the radiologists, we'll never catch up. This is an impossible problem. What it means for all of us is that we're waiting longer than ever to get the life-saving diagnosis we need, and that by the time the radiologists start looking at this scan, they're spending less time than ever, and the error rate is climbing. This is why Harrison.AI exists. We build specialist medical AI system that can analyze medical images, detect and characterize critical conditions and diagnosis, alerting care team of critical findings that they need to attend urgently, automating report generation and documentation, something that's time-consuming for doctors. Ultimately, we make diagnosis faster, earlier, and more efficient. Don't get me wrong, this is a really hard problem. For whatever reason, we love to benchmark these AI systems with human exams. And in medicine, I promise you, there's plenty of it. The test that we run earlier this year is called the FRCR Rapid 2B exam, designed by the Royal College of Radiologists, designed to credential radiologists before can start practicing. Maximum score is 60%, is 60. The radiologists have to detect if the case is normal or abnormal and make the right diagnosis. You can see that this is a very hard test. Even credentialed radiologists only score 50.64 on average. And most modern LLM today is scoring just above random guessing. This is not so surprising. Many of us may have tried our own scan on this AI agent system. And you know there's very level of accuracy there. The challenge is that the internet simply do not have millions of high-quality medical images And the task of giving you a good human response is very different to making the right diagnosis in moment that matters. And that's exactly what Harrison.AI is doing. We focus on training specialized AI system on millions of anonymized exams and fine-tune that with radiologists in the loop through reinforcement learning specifically for medical accuracy. And that's the difference. The beauty here and the promise of all of this is scale. Once the technology has been built and validated, it can never be unbuilt. It can scale infinitely, anywhere, anytime. What we want to do is to give healthcare the thing that is truly missing, an autoscaler. With COVID and other healthcare conditions incoming to our society, the aging population, the ability to dynamically scale up and down our ability to make critical diagnosis will be one of the fundamental technology of our time. I'm excited to be building that. Today, we are processing 35% of chest X-ray in England, for example. Every public emergency hospital in Hong Kong can run seamlessly with our AI through compute. And in Australia, 50% of all radiologists is using this tool. So if you had an X-ray, a CT recently, chances are the AI is already help catching those critical diagnoses in those moments that truly matter. Because ultimately, it is about patient outcome and that everyone can breathe easier. About us, we have this audacious goal that we set for ourselves 5 years ago when Harrison.AI started. We want our technology to positively impact 1 million daily recurring lives. 2 years ago, we blew past the 1 million lives per year in terms of scan analyzed. We just celebrate 10 million scan per year analyzed. And as you do the math, there's a long way to go, and we come really far. There's many problems that AI will solve. This one is worth solving. Thank you.